here, and I'm here for part 2 of Let's Interview My OBGYN Husband with Random Questions from the Audience. That's a really long title, I'll have to shorten that. But I am excited to ask...
Like an abbreviation. Be like 10 letters long.
Okay, I'll come up with that later. All right, first random question from the audience. Won't name names here.
No, come on.
Vagina sizes. Men are obsessed with penis size. What size vaginas do you see and how varied are they? Quit looking at the people. These are anonymous questions from the people.
Yeah, there's some variation.
In the external or internal bolts?
Both.
Does a woman want to have a big one?
See, there's
or a small one? It's like the opposite for a girl.
There's a soulmate for everyone.
There's a perfect fit? Mm-hmm. Okay. All right, this is a random question from a family member.
That was a hell of a way to skirt that question.
Yeah, but I'm going to change...
I'm going to pat myself on the back for that.
That was good. It was good. It was good. I'm going to change your family member's name for confidentiality purposes.
So why are we announcing that this is one of my family members?
Makes it funnier.
The first lady was anonymous. Now it's my family's question.
My crotch is itching so bad. Haven't had sex in 10 years. You told me to douche with half peroxide and half water, and it still hasn't helped, but it still itches, and I can't even sleep at night. Ask John, that's what they call him, about that, and tell him we'll say Rhonda is asking, Aunt Rhonda. What would you say to Aunt Rhonda?
Let's clarify here first. This is not a family member.
That's true, it's not.
Is a friend of
it's really not, I messed that up.
I don't recall her asking me anything about this. Maybe
wow.
She hallucinated it.
Aunt Rhonda.
Or did she ask you?
No, she probably asked your mother. Who asked you. It's okay. Aunt Rhonda, you need to go to the doctor.
No,
right?
I mean, if it's itching, she could just try some Monistat.
Or over-the-counter Monistat. Okay. That was a good question. Why don't pussy farts happen all the time during sex?
Jesus Christ.
Why is it a limited time pussy fart? It has to do with the circumferential air diversification process and the angle of the positional situation and the flappers involved. Does that sound good?
If it's happening, he's probably not your soulmate. It's not a good fit there.
Anybody ever really used the get off method during childbirth? I love these questions of the viewers. I love the people.
The only people that I've ever seen...
He's having a hard time with this.
It wasn't like intentional. It wasn't like okay, here's a patient that was, like at a birthing center and trying to do nipple stimulation or something like that. It was like, a psych patient who really isn't all there because they're on a lot of medicines and they're constantly touching themselves, but it's
so it's not something that you don't write that in your orders per se. Induction via get off method.
You guys might have had that back in the day when you did paper charting and stuff.
Shut up.
Like in your article there.
Shut up.
No.
Do you ever look at one and think, oh, thank God this one's pretty, or at least shaved so you can find it? I'm always like, do you people ever bathe? How do you feel about this? Is it better if they're clean? Does that make a difference?
Of course, but really what is the biggest problem sometimes is people's dirty feet.
Oh yeah, that's gross.
Because they're in the stirrups, right?
At least keep some socks on, for Christ's sake.
They're very close to your nose, the feet are.
This is one of my top fans asking this. What do you like, wet or dry? Next! Okay. Do you want to answer that?
Well, I mean...
Is she talking about birth?
It makes difficult...
Was she talking about birth or sex?
It makes it difficult doing an exam.
Okay, how can you not know that you're pregnant? Legit had a friend who was 34 weeks and didn't know until she went in for abdominal pain, and voila! You're 8 centimeters dilated.
Voila.
How does this happen?
Well, there's two things. Some people's periods are very irregular, so skipping months at a time is not uncommon. Right?
Okay, fair enough.
And 2, you probably add that on to somebody who has some infertility issues and probably thinks, oh, I'm, in my late 30s, there's no way I can ever get pregnant, and they just never think about it.
You think weight could play a role?
Well, yeah, I mean, to get to 34 weeks, and you would have to at least be like, oh my goodness,
Oh my goodness.
I'm really gaining some. So yeah, I think that's a little far-fetched.
This is interesting.
That's denial, getting the full term, but...
In Brazil, I hear they shrink the vagina by using what looks to be an instrument much like a hot curling iron. Do they do anything like this in the US? If so, what is it and what is the healing process? You ever heard of this?
We have lasers, but that's normally used for people who have like atrophy from having low estrogen states and getting a little bit older, and not like...
Does it hurt or anything?
Shrink it. Here in the States, we do the rejuvenation. We just do the straight up surgery.
Has he ever lost his watch? Well, yes. He loses his watch all the time.
But no, not during like an examination.
Oh, thank God. That would be embarrassing, wouldn't it? How come no one talks about an outie vagina? And how did I just find out about it at 30 plus years of age?
I think older people talk about it.
You think it happens later in life?
Yeah. You have,
And
that's
is
when
that-
you have prolapse. Yeah.
Is that where it comes from, like a prolapse bladder, or is it the vagina just gives up?
Depends on what
Tired?
part is coming out. I mean, if the uterus is coming out, then it's a prolapsed uterus. If the uterus is still there, but the bladder's falling down.
Have you ever gone to do an exam and you're like, shit, that vagina just fell, it's out, it's an outie, it's prolapse, it's there it is.
And that's where vaginal hysterectomy started, because you look at this thing and it's like, well, good God, it's all the way out already. We just gotta.
Ew, God, I don't. I'll ask it, but I would probably cut this out. How many times have you gotten turned on at work and then came home and took it out on your?
Took it out.
Wait.
That's-
How many times have you gotten turned on and came home and let her have it?
0.
Thank God. Good answer, honey. Here's a new term. Why do you think women refer to their vagina as a she shed? Like, are they storing things in
Because they've been
there?
on Pinterest too much? I don't know.
Is it just like it's your place? It's your getaway zone?
I guess. Some people do decorate them, so.
In menopause, should I bleed like a racehorse when I have sex? Literally ruined a mattress. Damn.
If you are in menopause, where you've gone an entire year without having a period, you should never bleed again. And if you're bleeding, you should see a doctor.
If you're in pre-menopause,
If
could
you're
that
in
happen?
Perimenopause,
Perimenopause.
yes, there's very common to have bleeding abnormalities during that period of time. But even then, it'd be something that you should probably get looked at, because your risk of having...
At a minimum, get a
Endometrial
waterproof
cancer.
mattress pad, right?
No.
At a very minimum.
You want to make sure that nothing's wrong, and you want to make sure that your sex life isn't ruined every time you have sex.
Or
right?
just get the Chucks pads from work, the waterproof Chucks pads, and just line those up. You'll be ready to go. Will you lie to me if I go poo while I'm pushing? Or will you just tell them if they ask?
Most of the time I'll tell them, like, especially if they're constipated, I'll just say it straight up at the front. Hey, look, I know you might like feel uncomfortable,
But there's Rocky Road
but
in
there's
there?
no way, it's not going to be possible to have this baby without pooping. So just
Let it go.
Let's
Let
just
it
get it
go. Okay. All right. And do you take care of that, or you tell the nurse, excuse me,
bam.
there's a turd flying out at...
We have to stay sterile.
There's a turd at 6 o'clock.
Yeah.
6 o'clock, or would it be midnight? 12 o'clock?
Well, we just come in the room when they're crowning anyways,
Okay.
right?
How common is it for women to have 2 vaginas? Is that really a thing?
I wouldn't say that there's 2. They have one that has a septum in it, dividing it in half. So it's not like you have 2 full-size vaginas.
You don't go down there and there's like 2 sets of labia. No, 2 sets. That'd be 4 labias majoras, 4 labia minoras.
It's extremely uncommon.
Okay, so you've never seen side by side.
I have. I've seen it.
You've gone down there and seen 2.
It doesn't,
I'm thinking of the external vagina.
It doesn't typically go to the external vagina.
Okay, that's what I was getting at.
It's an internal.
Because that would be messed up. I mean, how do you approach somebody before intercourse? I'm just warning you, pick the left hole, not the right, because the left one's my favorite.
You just call your buddy in so he can help out.
John! Oh my God. Why do you think it's so hard for men to find the clitoris? I think it's because
you're asking them 99% of the time. You're asking them to find something in the dark, right? Like if you could let them put on a headlamp and have a couple spotlights, maybe go into the garage. You know, they might have a better chance at.
And I think it's because it's hidden. It's a hidden, if you will. It's like it's got a little hood, and it's. I mean, on most women.
Picturing him in the garage now.
Come on, baby. I want to do this right.
I gotta find this kid.
I want to do this right. Come here on my car lift, right?
So
have you ever accidentally examined the wrong hole?
No, but I had a family practice resident that I was like supervising that did one time on L&D. It was hilarious.
Yeah, but you can actually check the cervix through the
that
butthole. That's true.
A long time ago, yeah.
So maybe he got it right. I don't know. But that's embarrassing. Did you tell him later? Like,
oh, she told him immediately.
Oh, okay.
She didn't have an epidural or anything, so.
Well, you went in her butthole.
She
was probably like, woohoo!
He was so embarrassed, poor guy.
Have you ever been so uncomfortable that you had to leave the room? Like the patient is just doing something to make you feel uncomfortable?
No, I would say no. I mean, there's some women that are forward and will make like inappropriate comments, but they're never like. Oh,
how about the ones that flirt with you, honey? The women that are like, ooh, Dr. Sides.
Yeah.
Does it make you blush? Or are you like, keep it coming, feed my ego?
I don't know if it really helps my ego at all. I mean.
Okay. Are you extra nice to them when they do that, though? Are you like, they get more lidocaine?
Did I ever tell you about the jail patient?
No, I don't think so.
So we had a jail clinic, and she's like in there in shackles, right? You know?
God.
And she talks to one of the nurses like after we do the exam, and she's like, "Is he single? Do you think he'd go for me?"
Oh Lord Jesus! Wow, that is
like, oh yeah, he loves the ones in shackles. Yeah.
Maybe she's like a mystery, you know. You could handcuff her and she'd be okay with it, you know. What do you do for a very tender episiotomy scar? Baby is 25 years old. What does that mean? Why is it tender down there?
That kind of stuff is really hard to treat.
It does happen though?
Yeah. Yeah.
Maybe they need a refix.
You can try to treat it surgically. Sometimes they try to do injections, but it tends to be a really difficult thing to treat.
That's awful. I didn't even know that happened. Has he ever had glitter poof out of one? So we covered the glitter on the outside, but has it ever poofed out at you? Like a magic trick? Because they have. This fan of mine has had that happen.
Did she video it?
I don't know, but I would like to know about that. Hi, I saw you're doing another video with your OBGYN husband, and I have a huge question I've wondered all my life and can never find the answer to.
Why do they have to specify OBGYN husband? Who's the other husband?
That one is the stripper.
Don't we all know?
I have male
the stripper husband,
Magic Mike, and then I have the OBGYN husband.
I got it. I'm glad.
So they didn't have a question for him this time.
No.
It's for you.
Okay.
Okay. I was born with a longitudinal septum, complete in canal, but doesn't extend to the uterus, and only one cervix. What are my chances of a natural pregnancy and being able to deliver naturally?
So you have like the vaginal canal. You can have a septum that goes straight down, making two separate vaginal canals.
Okay, do that. All right.
And
Okay.
those absolutely you can get pregnant.
Okay. Or is it that then you could?
It can make it difficult to.
Because you might only feed it to one tube. Is that?
No, because she's saying she only has one cervix.
Oh, okay.
So from the cervix and above, it should be normal. She could have a little bit of a septum in her uterus. So there are some people that have a septum that goes across. But typically, those are found very early in teenage years because when you start menstruating, the blood just backs up and backs up and backs up and backs up until you take the septum down. So those longitudinal septums, they shouldn't inhibit anything at all. It may make delivering difficult depending on how thick it is or the placement of it. And then the thing that really impacts fertility more is whether there's a septum in the uterus, which can happen in these types of patients.
So the answer is you would probably need a little more information, but it could have a little bit of an impact, but there still could be a high chance of getting pregnant too?
Yeah. I mean,
and will the baby come out naturally?
That's what, it depends on the way it looks and where it is. But
so if you could just send us a photo, drop it in my inbox on my page. I don't know. If you want to ask more detailed questions, you can. We don't mind at all. Dr. John has all the time.
All the time in the room.
Well, thanks, guys. That's a wrap. And why do you always run? Why?
Because we got to get back to the kids.
All right. Thanks, people.